Good morning.
Morning.
Could you please tell the jurors your first and last name?
Rachelle Amedee.
Do you mind spelling your first name for the record?
Rachelle. Last name is Amedee.
Thank you. And how are you employed? What do you do for work?
I'm a nurse at Brigham and Women's Hospital, the trauma surgical ICU.
How long have you been a nurse?
Almost 27 years.
And can you tell us a little bit about your educational background?
I have a bachelor's in nursing from Salem State University.
And how long have you worked at Brigham and Women's?
20 years this week.
And which unit did you say you worked in?
The trauma surgical ICU.
How long have you worked in that unit at Brigham?
8 years.
Going back to January of 2023, were you working in that same unit?
Yes.
And what was the shift that you normally worked?
I work the night shift, which is 7 p.m. to 7 a.m.
And what was your schedule like for any given week? Did you work back-to-back shifts or?
I can sometimes work back-to-back shifts.
Okay, but you always worked the night shift?
The night shift.
Okay. I'm going to draw your attention to a particular patient that you had some interaction with in January of 2023, and that was Lindsay Clancy. Do you recall treating her?
Yes.
And was she in that trauma surgical intensive care unit?
Yes.
Do you remember the first time you interacted with her?
Yes, I got her.
And would that have been on the first night she was there on January 24th?
Yes.
How did she come to your unit at the Brigham?
She came from the emergency room, went to MRI, then came to the ICU to me.
And were you aware that she had been seen at a local hospital?
Yes.
In Weymouth, the South Shore Hospital?
South Shore.
While you were treating her on that first night, were you the main nurse assigned to her care?
Yes.
And what were your responsibilities as the nurse assigned to her care on that first night?
First night, she was intubated, came to me intubated. We had to maintain her blood pressure at a certain number, just care, regular nursing care.
Okay, and were you aware that she was on what's called a one-to-one?
Yes.
What does that mean?
That means patient usually can't be left alone, and also depending, you always have to have somebody outside the room to monitor the patient.
And is that because that patient has been identified as a potential suicide risk?
Yes.
Okay. Now, on that, the 24th into the early morning hours of the 25th, was there a particular event that you were witness to for this particular patient?
She coded.
What does that mean?
Means her blood pressure dropped for her. It meant her blood pressure dropped and it wasn't sustainable with life.
So what did you do when her blood pressure fell and she coded?
We started CPR, we did compressions.
And this event occurred approximately at 3:30 in the morning, correct?
Yes.
Was she eventually stabilized after that code?
She was.
And did they do something as far as intervention to try to maintain her blood pressure?
We increased her pressors. We added 2 more pressors. She was already on 2. They placed chest tubes in, started what we call a massive blood transfusion protocol.
And did this all occur in the trauma surgical intensive care unit, or did she have to be taken to a different unit?
No, it all occurred in her room.
And other than medical staff that was treating her that particular night, did you observe anybody else present?
She had 2 police officers outside the room.
Okay, and so did they remain outside the room for the duration?
Always outside the room, yes.
As far as your interaction with the patient on that particular night shift, was she responsive at all during the time that you saw her?
No.
And with intubation, you mentioned she was intubated. Is a patient often sedated in order to maintain intubation?
Yes.
Why is that?
Helps them not fight the vent, breathe better, and make sure that they're comfortable.
And what does sedation do to an individual?
You're calmer, you're sleeping.
Makes them more relaxed?
Relaxed, yeah.
Other than that night, that first night, the 24th into the 25th, did you have the occasion to treat this patient at other points within that week?
Yes, I have.
And I'm going to draw your attention to January 26th of 2023. Do you recall interacting with her on that day?
Yes.
And is it fair to say that on the 26th she was still intubated?
She was.
And under sedation?
Yes.
Well, during this time period on the 26th, was she arousable, meaning could you initiate some communication with her?
Some, yes.
And were you able to kind of give her commands in order to care for her that she was able to follow?
Yes.
And when I say able to follow, obviously...
Simple, yeah, commands.
What kinds of
like, can
commands?
you squeeze my hand? Can you wiggle your toes? Just basic neuro check to just make sure she's alert and she's able to follow, understand what you're saying to her.
And for this particular patient, you're aware that she presented with a spinal injury, correct?
Correct.
And so movement of the lower extremities was not something that she did?
Correct.
But did you observe her to move her head around and move her arms around?
Yes.
Now, you also had the occasion to treat her in the overnight shift of January 28th of 2023, correct?
Yes.
And during that time, she was also still intubated?
I believe so. I'm not sure. I've had her both intubated and
okay.
extubated.
While she was still intubated, did you have a system that you could use to communicate with her?
Yes, board. We have a whiteboard or clearboard that sometimes patients can write on.
Did you observe her to utilize that whiteboard to write on it?
Yes.
And at this point, when she's writing on the board, her eyes are open and she's responsive?
Yes.
And she's able to tell you how she's feeling, correct?
Yes.
And fair to say she used that whiteboard to tell you she was confused and that she couldn't feel her lower extremities?
Yes.
And do you recall her complaining of having pain?
I don't recall.
During this time period on the 28th, do you recall whether the patient was placed into restraints?
Yes.
And why was that?
Well, we restrain all patients that are intubated for safety.
And why?
So they don't pull out the tube or pull out any lines that they have.
Okay, and so as they're not at that level of sedation anymore where they're just completely asleep, there is danger that they could move and cause damage to...
Medical equipment out of the way.
Okay. Yeah. And so in this case, as far as the restraints go, fair to say that they were soft restraints?
Soft, yeah.
And what does that look like for a patient?
Meaning?
Well, like, how do you... What does a soft restraint look like?
A soft restraint, it's like maybe I would say a cushion restraint, and then it's tied to the sides of the bed. So it's all the way around your wrist.
Okay. At some point by the end of that shift, do you recall that she was extubated?
Yes.
Can you tell us what extubation is?
That means you remove the tube. You usually stop all sedation.
And were you able to make observations of the patient once she was extubated?
Yes.
Did her presentation change at all from your previous interactions with her?
No.
Did you have the occasion to treat her again on January 30th?
Yes.
And again, at that point, she has already been extubated? And are you able to then make an assessment of her without the tube in about her orientation and her alertness?
Yes.
Is that something that you kind of do each and every shift?
Every shift, yeah.
Was she still on sedation medication at that time?
No.
And what was your observations of the patient's demeanor now that she's extubated?
She's flat, no emotion either way.
And is that fairly consistent with what your observations of were of her during the course of your time treating her?
Yes,
How about being alert and oriented? Did you observe her to be alert and oriented?
she was.
And did you observe her to identify sleep as an ongoing issue?
Yes,
And so as part of the plan for treating her, did you address the sleep?
yes.
And how did you guys address sleep?
The plan was to start the first sleeping medication for her. I don't remember exactly which one, and then wait a couple hours, see if it worked, and if not, try another medication.
Okay, and this actually occurred over the course of a few days,
Few
correct?
days, yeah.
During the time when you observed her to be flat, as far as her affect goes, did you also observe her to be cooperative,
Yes,
meaning she followed your directions?
yes.
Did you treat her, or were you the overnight nurse for her on February 2nd? You recall?
Yes.
On this particular night, February 2nd, do you remember her making a particular request of you or ask you for something specific?
I think that was the night she wanted to reach out to her lawyer.
And did you note that in your nursing notes?
Yes.
Why did you note that particular request?
Objection. Can I see counsel? Yeah, counsel, go ahead.
Thank you. So on this particular night, the 2nd, she made a request of you for her lawyer, correct?
Yes.
Was that something she had asked you before?
No.
And so did you think it was something worth noting?
Yes.
Why would you note something like that?
Because that was the first time she referred to anything going on with the case. Or what
Okay,
have
and so you had the occasion after she was extubated to have some casual conversation with her, correct?
you. Yes.
And this was not a conversation you'd had before.
No.
What did you do when she made that request? What was your response?
I sent what we call a consult to the social worker in order to coordinate reaching out to her lawyer.
In any of the shifts that you had been caring for this particular patient, did you see anyone besides medical staff and the law enforcement that were outside of the room come in and speak with her?
No.
Were you aware that she was not to have visitors?
Yes. I was told the first night.
And is that something that you've seen before in your work as a nurse when there are police on site?
Yes.
Were you present at one point when some troopers came in to take photographs of her?
Yes.
And were you in the room when they took the photographs?
Yes.
Do you recall assisting them in viewing the injuries to her wrists and her neck?
I don't know if I don't remember assisting.
Okay, but you were present.
I was present, like, in the room with her.
And fair to say, your contact ended with this patient on February 3rd when she was transferred off of the trauma surgical ICU unit.
Yes.
So, one moment.
Sure.
Now, you were not the only nurse to treat her on the night shift, correct?
Correct.
So on days that you didn't work, another nurse treated her.
Exactly.
And were you familiar with the nurse who was generally assigned to treat her during the day?
Yes.
And who was that?
Megan. Collins.
Megan Collins. And is it fair to say that with the law enforcement presence and this patient's particular situation, the amount of medical staff that were treating her on a regular basis was fairly limited?
Correct.
Meaning it was the same
Yes.
people all the time? Okay, thank you.
All right. Attorney Reddington.
Morning.
Morning.
So first of all, you have the certified copies of the records from Brigham and Women's Hospital. I'd like copies. Is that clear?
All right. Commonwealth, any objection?
I actually have those on a disc. I was going to put the disc in instead of all the paper.
Why don't we put both in?
Sure.
We could do A and B.
Thank you. Now let's talk about a lawyer first, since that was the last that they asked you about. And correct me if I'm wrong on any of these dates or facts. She was admitted on the 24th of January. Is that correct?
Yes.
And do you have a memory as to approximately what time was it in the evening?
Well, she got to the ICU, it was around 3.
Okay. You're very soft-spoken.
Sorry.
If you can just keep your voice up so all the jurors can hear you.
She got to the ICU around 3 a.m.
Thank you. And she came by med flight?
She came to me from MRI.
And MRI obviously would be when you're taking the pictures.
Picture,
yeah. And that would be on the 24th of January in the early morning hours, correct?
I think it went into the 25th.
Into the 25th?
I think so.
Counsel asked you about the whiteboard that she would write on. And I think it was, again, if I'm wrong, correct me, was it January 28th that she used for the first time the whiteboard to communicate?
Yes.
And the whiteboard basically is just a whiteboard, and,
Yeah.
and you write on it.
Erasable.
And she was not able to speak because she was intubated, right?
Yes.
And she was in the restraints that you've described as well, right?
Right.
Moving forward, January 28, 29, 30, into February 1st, February 2nd. It was on February 2nd that counsel asked you about, and do you know who her lawyer was at that time?
No.
Had you seen him before?
No.
Did you know, is his name Attorney Gelb?
No.
Make any reference to you?
No.
Do you know that whether or not she had conversation with Attorney Gelb regarding her status as being under arrest by the numerous police that were guarding the room?
I don't.
Do you know whether or not she was ever able to talk to Attorney Gelb, or did you refer her to the social worker people?
I put in a consult for the social worker.
Okay, thank you. When she was admitted on the 24th, would you agree that she was in the state of cardiac arrest shortly thereafter?
Shortly after arriving to me.
So I'm looking at the medical records that have been introduced for the jurors, and I'm referencing on page 18, if I may. Now, this is one page of 400 pages of medical records.
Can you see that?
But
All right, here we go.
looking at this, does it indicate it's an SICU course?
Surgical ICU.
I'm sorry?
Surgical ICU.
Okay. And that makes reference to the fact that shortly after arriving in the ICU, the patient had a cardiac arrest. Is that there?
Yes,
Were you there then?
I was.
And when it says the etiology of the arrest, She got 2 rounds of CPR before obtaining ROSC. Can you tell me, please, what is CPR at 2 rounds and what is ROSC?
Meaning we did chest compression. She was already intubated, so she was getting oxygen.
Okay. And then bilateral chest tubes were placed in her body?
Yes,
Does that mean from both sides?
both sides.
Okay. And that punctures through the chest into what, the lungs?
The lungs.
Okay, the lungs. And when they placed the chest tubes, at this point, shortly after admission, there was 100 to 300 cc's of blood from each chest tube? What does that mean?
That's the output they got once they put the chest
Sorry
tube.
again, just can you keep your voice?
That's the output they got once they put the chest tube in?
Okay. So when they put the chest tube in, it drained 100 to 300 cc's of blood, is that correct?
Correct.
And then after that, again, shortly after admission to the hospital, coming from South Shore Hospital, she then got a massive transfusion protocol, which you told us about, right?
Yes.
And what does that mean?
Means she gets, we have a protocol that with blood, depending, blood products,
Okay.
she gets infused rapidly.
And was there a notice shortly after arrival to the ICU, she was being turned and had 30 cc's of clear fluid that came out of her nose, is that right?
Yes.
And what is that? Was there a suspicion that that was what's called CSF?
Yes.
And what is CSF?
It's spinal fluid.
Okay. Going to the next page, which would be 19, does it indicate, again, on there, if I can just bring this up a little bit better. So she now has noted acute blood loss, anemia, right? What does that mean?
She has a low blood count.
And do you know what happened to the blood or any idea?
I do not.
So she had very low, lost a lot of blood, right?
Yes.
And she had anemia. That would be what, low blood or something?
Yes.
And she required multiple transfusions immediately following her arrest, right?
Yes.
And when it says arrest, does that mean arrest by the police or does that mean the cardiac?
Cardiac.
I want to make sure that's clear. It's cardiac arrest, nothing to do with the police, okay. And she had required multiple transfusions. And you were there for that, correct?
Yes.
Were you aware of the extent of the, after you had the after you have the MRIs and the CAT scans, were you aware as her, the lead nurse or treating nurse as to what the extent of her injuries were?
At that point, I don't believe so.
At some point, did you become aware of that?
Yes.
Okay, so, and again, I've got the records, you don't, so let me do it this way, just to make it easy. Do you remember that she had a burst fracture of C1?
Yes.
What does that mean?
Means a cerebral fracture.
That'll be up here? So this is the cervical spine
Cervical.
up here?
Mm-hmm.
And then T5 and T6, there was a transection. What does that mean?
Thoracic.
Okay, so
On
that'd
the
be
spine.
about down here. And when it says transection, what does that mean?
It's severed.
And then T1, 2, 3, 4 also were injured as well, right? Mm-hmm. What is neurogenic shock? What does that mean? If you know.
Neurogenic shock.
Sorry, yeah, neurogenic shock. It just makes reference on.
These are not my notes, so I can't really.
That's fine. I understand. And this would be on page 65. Do you recall reviewing the documentation as to what's captioned present illness in the records? Did you know that she was presenting as a transfer from South Shore Hospital?
Yes.
Did you know that that under present illness and the history would be that she's a 32-year-old female with history significant for postpartum depression? Did you know that?
Yes.
And did you know that after the fall with the C1 burst fracture and the complex transection of T5 and T6, She also had rib fracture, correct?
Yes.
On page 66, that would make reference to the time frame going into the 25th, on the 25th, that she was reacting to painful stimuli, right?
Yes.
And that basically means that she's not conscious, if you will, but she's able to react to,
If you cause pain.
yeah, okay. There's a notation of a contusion, laceration, and crushing of the thyroid with thyroidal edema. What does that mean?
She has swelling, I'm assuming, around her thyroid.
Okay, and that is,
Again, this is not my scope
okay,
of practice, so.
okay. On page 70, the same evening, making reference to the fact that in addition to the injuries to the spine, that she also had the rib fractures and was currently in shock. Do you remember that she was in shock? Yes, no?
Yes.
Okay. Would you agree, or do you recall that there's a notation that this patient is critically ill, and noting that she has postpartum psychosis on page 72?
Objection.
I see counsel.
When you're treating a patient, one of the things you try to do is to know what their total body and emotional condition is, what they've been dealing with, and what injuries they have, right?
We get a rundown or history of the patient.
Sure. And as it goes into the end of January, and she had been communicating on the whiteboard, you were aware at that point why she was in the hospital, right?
Yes.
You knew where she came from, South Shore Hospital, right?
Yes.
And you knew that there had been discussion about postpartum psychosis. Isn't that right?
Yes.
Okay. And do you recall that, and this would be on, may I approach you, Honor, the witness?
You may.
Thank you.
You can maybe, if you could show counsel. Wait.
I want the date and the time. Okay, and the lawyer, legal team. So I'm just showing you one page from the medical record. Can you tell me in terms of what date is this page from?
125.
January 25.
If I'd ask you if you keep your voice, at least speak in the
Oh, sorry. Yeah.
No, thank you.
January 25th,
Okay, does it say what time?
9 a.m., 9:03 a.m.
All right, can I see that for a second? Thank you. And looking at that, do you recall on that date, you had been working with her the night before, correct?
Correct.
Where it indicates that the patient is under arrest, right?
Yes.
And there are police officers at her bedside, right?
Outside the room.
Well, it says at her bedside on the record, doesn't it?
In the record, but I'm saying
So
they
and the night before,
were outside her room.
outside the room. You were not there during the day, apparently, right?
Correct.
Okay. And there's a difference from you guys as far as your medical records. If the police officer is at the bedside as opposed to sitting in a chair in the hallway outside the room. Right?
Yes.
Okay. So indicating police officer at her bedside, we will involve the social work and legal teams, right?
Yes.
Okay. And again, on page 72, there's a reference to CSF leak And that's significant, it says significant amount of fluid coming from her nose. Do you have any memory of observing that in your treatment?
I did.
Okay. And then, of course, there was the code event that you've already described for us. There's the 100 to 300 cc's of blood coming from the tubes, and then it makes reference to, on page 74, to massive transfusion protocol. Is that like a medical term, or is that somebody
Yes,
describing it, or?
It's a medical, like, it's a protocol that we have at the hospital.
Okay. And on page 75, did you make reference to, or did you observe the injuries, for example, to her wrist?
I observed.
Yes. And would you agree with me, page 75 of the medical record, indicating if it says RUE, what does RUE mean? Do you know?
Oh, right upper extremity.
Right upper extremity, 3.5 centimeter deep laceration, volar aspect of wrist. Can you tell me what is the volar aspect of the wrist? I just don't know.
I'm not sure what
Okay,
that's
that's all right.
referring to.
That's fine. Would you agree that there was noted a 3.5 centimeter deep laceration on her wrist?
I can't say because I didn't measure. This is somebody else's note, so.
Well, when you looked at her, did you observe with your own eyes and your own experience that she had a deep laceration on the...
She had a laceration, yes.
You can't say it's deep or not?
I can't say. I didn't.
You want to say it was superficial?
I can't say that either.
So when you looked at the laceration on her wrist, you
Yeah.
can't tell us if you would agree that it was a deep laceration.
I really didn't get to assess it at the time when she arrived. So.
LUE, underneath that, left upper extremity apparently, right?
Yes.
2 centimeter deep laceration, again, on the volar aspect of the wrist. You did see laceration on her left wrist?
Yeah, she had dressings.
Okay. And when she was admitted, she had the core temperature of 82 degrees. Is that correct?
If that's what's noted.
All right. Do you remember, did they use a bear claw or something like that? What is it they call it? They put
A
the
bear hugger?
bear hugger. They put a bear hugger blanket on them. And when I say them, I mean people that have a low,
Low temperature to warm them up.
it hopefully raises the temp, right?
Temperature, yeah.
And then if it has warm intravenous IVF, that would be putting warm saline in the body?
Yes, through an IV.
All right, all with an effort to try to get the temperature up, right?
Yeah.
And her core temperature was 82 degrees even after she was at the South Shore Hospital and underneath the bear thing and all that, and still?
If that's what's noted.
Yeah.
Again, that's not my note.
That's pretty low, isn't it?
It is.
Ms. Amedee, the first time that Ms. Clancy, the defendant, the patient, used a whiteboard with you was on January 28th, correct?
Yes.
You're not aware of if she used that tool with other nurses on other shifts, were you?
No.
And the first time that she mentioned a lawyer on the February 2nd, that's the first time she mentioned a lawyer to you, correct?
Correct.
You were asked about the trauma in the chest tube and that she lost 100 to 300 cc's of blood.
Yes.
The transfusion came after that, correct?
Yes.
And fair to say the course of her treatment coming to Brigham was that she first came in through the emergency department, correct?
Yes.
Then she was sent for an MRI,
Yes.
and then she came to the trauma surgery, correct?
Yes.
And you're aware that she had other imaging like CT scans, correct?
Yes.
And that especially when it came to the head CTs, she didn't have any intracranial injuries or anything that required that you be focused on her head injury, correct?
Correct.
So it was more a cardiac issue and keeping her stable and internal bleeding in the chest area.
Yes.
As far as what you're aware of from other treating physicians, you're aware Dr. Anderson was one of the trauma surgeons that was treating the patient?
Yes.
And he was making assessments and giving orders to you and other nurses, fair to say?
Yes.
And are you aware that he identified in the history that this patient actually had a history of postpartum mood symptoms, not psychosis?
I would have to look at the note. I don't remember.
Those aren't notes that you would have written?
No.
And you weren't taking a full history of the patient?
Not at the time, no.
Were you aware that she then subsequently was fully evaluated by the psychiatric team?
I knew she saw psych, yes.
And were you aware that they ultimately identified that there's an inherent uncertainty in her diagnosis?
I do not remember.
As far as the lacerations went, in your treatment of her, again, you treated her overnight shifts for various days, correct?
Yes.
Did you ever have a situation where you had to change her bandages because they were seeping?
No.
And are you aware that
Except for the first night, but we didn't get to that because she coded.
Because she coded.
Yeah.
And then you're aware that the next day after, another individual, a physician's assistant, actually came in and treated those lacerations.
Sutured, yeah.
And as far as Dr. Anderson goes, were you aware that on January 25th, he noted that the lacerations to her neck and wrists were very superficial and didn't require treatment at that time?
I was not aware. Don't remember that note.
Would you, if I showed you the record that that's in his note, would you agree that that's an assessment that he made?
Yes.
Okay. And he didn't instruct you to do anything further with those injuries?
Yes, right.
Thank you.
Very briefly.
Sure.
District Attorney asked you about the evaluation by the, as she put it, psychiatric teams with a determination that there was inherent uncertainty according to the psychiatric teams. Do you know when the psychiatric teams were evaluating her?
I don't know. It was during the day. I don't know what day, but.
But in any event, I did show you on the thing over there where the reference was made to postpartum depression, postpartum psychosis, correct?
Yes.
And that's all I have. Thank you, ma'am.
Anything further? No. All right, thank you, ma'am. Let me sit down. Thank you.